Learning about examination of an acute abdomen surgery case. What is acute abdomen? Acute abdomen means patient suddenly complains of an acute attack of pain in abdomen. It can occur either suddenly or gradually. Gradually means it will occur over a period of several hours to some time. But we have to treat this immediately because it's a life threatening condition and it can lead to fatal outcome if we don't intervene. So it will need an immediate urgent diagnosis or else it will worsen the condition. Mainly based on history from age. A few abdominal conditions are peculiarly seen in a definite age group, mainly newborn. We can start with intestinal atresia. If it's not atresia, narrow down means stenosis or intestinal obstruction. It can either be due to meconium or meconium ileus, etc. In infants, intussusception and Meckel's diverticulitis. Children, as you all know, in children, this is the most common cases: appendicitis, non-specific mesenteric lymphadenitis, primary pneumococcal or streptococcal peritonitis, and also roundworm intestinal obstruction. And in young adult, appendicitis and acute cholecystitis and acute pancreatitis. Why it starts in adults? Because they start drinking and all. So acute pancreatitis seen in adults. In elderly, sigmoid volvulus and intestinal obstruction, it can be due to any malignant growth. And sex. In mainly in females, things related to the uterus and the fallopian tube and the ovaries, ruptured ectopic gestation, twisted ovarian cyst, acute salpingitis, and then but mainly the surgery cases which is seen more commonly in women is acute cholecystitis, appendicitis, and primary peritonitis, whereas perforation of peptic ulcer, pancreatitis, and volvulus is seen more commonly in males. Occupation: painters may have a recurrent abdominal colic. This is due to lead poisoning. It can also be seen in arsenic poisoning. Residents: peptic perforation. It's actually common in North India and South India where people eat extremely spicy food. And acute cholecystitis. It is common in Eastern and Southern India. And appendicitis is more common in Western countries, wherein they consume a low residue diet or protein rich diet. And social status: perforation is more commonly seen in low income group because they tend to ignore that the symptoms of the peptic ulcer they have, so it will undergo perforation. And then chief complaints. Mainly in chief complaint, in any case of acute abdomen, the most common presentation will be pain, that is pain abdomen. So time of onset, this is most important because from that thing only we can come to a diagnosis of the disease. The pain of acute appendicitis, it actually starts in early morning, whereas sudden pain due to perforation of a peptic ulcer usually takes place in afternoon after the lunch break, because peptic ulcer which is present in the stomach, so it will aggravate after intake of the food, right? That's why. But the patient is often brought to the hospital at night. And mode of onset: perforation, as you all know, will be sudden in onset, even colic, torsion, volvulus, etc. But in case of acute intestinal obstruction, actually it's a gradual process. So initially the pain might not be severe, but it will gradually increase in intensity. And there's also something called as obstructive appendicitis. This is so severe that the patient, mainly it's present in the early morning. And also ureteric colic, it's mainly present during straining or by jolting. And then how long is history of presenting complaints of present. Now for example, pain can actually be of varying intensity and it can be on off type, lasting for few years, which will be appendicitis, cholecystitis, etc. Mainly the site of pain. Actually, when we do an examination, we'll ask the patient to do a pointing finger test, wherein the patient points the site of pain through a finger. But if the pain is diffuse, he'll actually use his entire hand to locate the pain. Usually, the site of pain will coincide with the organ present underneath. So, example, if the pain is present in the flank region, then we'll think it of a renal origin. And then if it is under the right costal margin, then either liver or gallbladder. Then epigastric region, peptic ulcer perforation, acute pancreatitis. Actually, during any examination of abdomen, we'll divide it into four regions. Four quadrants and nine regions. The quadrants are right upper and lower, and left upper and lower, and nine regions in the abdomen. Now, shifting of the pain. Actually, it's when you think of shifting of pain, you can think of acute appendicitis. Initially, it will be felt around the umbilicus, but later it will shift to the right iliac fossa. This is due to onset of the parietal peritonitis, so the inflammation spreads. So, hence the pain. Radiation of the pain. In spreading peritonitis, that is, initially the pain will be felt only at a particular region, but later it becomes generalized and spread um, over the entire abdomen. And in case of peptic perforation, pain is first felt in the right hypochondriac, but soon it will radiate towards the right iliac fossa. This is because as the digestive system proceed, the gastric contents from the stomach will gravitate down into the right paracolic cutter. So the pain also migrates. At this time, this condition sort of mimics acute appendicitis because the pain is spreading to the right iliac fossa. So, when the patient complains of a radiating pain towards the left iliac fossa while he's suffering from acute appendicitis, this is actually due to the spreading peritonitis.